Watch Politics on Sunday.
In health, Nigeria received 10,000 doses of the Mpox vaccine from the U.S. Agency for International Development. This is now the first batch of the vaccine to reach the country, which has confirmed 40 cases with no fatalities so far. According to the Executive Director of the National Primary Healthcare Development Agency,
it is a critical step for Nigeria in its response to ongoing Mpox outbreak, which is ravaging some countries.
About 200,000 doses are available globally, and Nigeria got 10,000 out of it. And like other countries, the vaccine shortage will hit harder as cases continue to rise.
The Nigerian government has decided to prioritize 5 states to receive the vaccines, including Bayelsa, Edo, Cross River, and Lagos, according to the USAID statement. All right, I want to have our guest Chika Ofo, of course, the Chief Executive Officer of the Vaccine Network for Disease Control, to join us to speak more on this issue. Welcome to the program. Hello.
Chika, if you can hear us, welcome to the program.
Can you hear me, please?
Okay, all right. Let's start with this. Let's begin with the Mpox vaccine donation we just got from the U.S. government. Do you think it's enough to stem the tide of the outbreak?
I mean,
okay, I think. Okay, I think that of course we'll get back to her. And as she gives us some on top. Okay, I heard she's back now. Can you hear us now?
Yes, we can hear you. I can hear you, but can you hear me?
Yes, I can. Yes, we can. You can.
Okay, good.
Okay, so
good.
I was asking that now that we have the Mpox vaccine.
I got the question.
Okay, all right. So go on.
Okay, so first and foremost, I want to thank. That at least we have the vaccine. We have 10,000 doses. But let's not forget that Nigeria, we have over 200 million Nigerians. And for each person is 2 doses. So actually, that caters for like 5,000 people. So what can I say? It is definitely not enough. It's a step in the right direction. But most importantly, we must say that the government has to be in front to make sure that we are the ones that can get these vaccines. It is not enough. And for us to do that, immunization is one of the key things that will stop the Mpox. So it's the vaccine. So Nigeria has to fund their vaccine story fully. And that's one. Secondly, line items in both places like MPACDO, NCDC, epidemic preparedness. We have to have line items around infection prevention and control, to make sure that at least we prepare for these epidemics and these vaccines are made available. After all, now money make on flow. We need funds to purchase vaccines. Nigeria has to have these funds. One epidemic to the other, we don't know what the next epidemic will be, but we have to prepare for it. And the first way to prepare for it is 1, to budget for it, 2, to have the line items in departments that need that to happen, and 3, to create demand. Those are the 3 important areas. Thank you, and over. Definitely 10,000 is a drop in the ocean. But
well, okay, so I mean, this is something that even before the outbreak of Mpox, Chika, you have been one advocate of proper funding for immunization. And now that we found ourselves here, and you're also saying that we can't actually depend on, being given globally, the vaccine is around 200,000 for, the whole world, and Nigeria got 10,000. So, but how can the government change this and improve funding? All right, this is a live situation, but we're trying to establish contact with Chika, and I mean, this becomes very scary. The fact that we are still struggling to establish development of vaccines and immunizations in our country.
So what is mind-boggling for me? Okay, we had Chika.
We have Chika joining us back.
Sorry for the network.
Chika, did you hear my question?
Yes, you said something about
you've been an advocate
but I didn't get the
government, Nigerian government funding and making budgets for immunization programs. Now that we found ourselves here, still having an inadequate vaccine for this outbreak, do you think that this could spur the government to start changing its approach to funding and budgeting for immunization and vaccines in the country?
Okay, yes, thank you. That's a very good question, and I'm very happy you're asking me this question. The first thing is, immunization is a preventive strategy, and it's always better to prevent, and always more cost-effective through prevention. Imagine you are taking only 2 doses for Mpox, for instance. If somebody has the Mpox, Nigeria is going to spend a lot of money to treat the person who has the Mpox. So preventive approaches is so important and so key, so that at the end of the day, Nigeria gains a lot in terms of the funding, in terms of man hours that you will waste when somebody has to be at home and the person is not at work because the person has a disease. So Nigeria has to just be at the forefront of budgeting right. Immunization financing, domestic resource mobilization for immunization should not be something we play with. And those funds should be at the forefront. That is the very first thing that is so important. Prevention is better than cure any day. Now there's a vaccine for Mpox, and there are vaccines for many other diseases, but it costs money for you to purchase these vaccines. And these vaccines are already so important to save lives. So Nigeria should not look back. Nigeria should not even, it's not something you think about. Nigeria should provide the funds, should budget properly. The National Assembly should budget properly. Whatever budget that the government asks for, nobody should touch it. They should provide that funds to make sure that vaccine preventive diseases, vaccines are provided for them. So that at the end of the day, you cannot list disease on top of poverty. So it's very, very important. And that's what I keep saying. If you look at the economic value of prevention, you will be surprised. Nigeria will gain a lot to these preventive approaches. Man hours will not be lost. Finances will not be lost. Death, mortality will not be there. So it's not something that Nigeria should joke about. And we're talking about also CSOs and other people should put their hearts in there, including media, to make sure that all these monies, these funds are released, budgeted for, released and utilized. Health financing is not a joke. We shouldn't play with it. The lives of your people is so key. And one of the first ways to do this is to make sure that you provide vaccines for people, especially for vaccine preventable diseases. So I'm very passionate about this. My own mother died from cervical cancer, a preventive disease. So these are the things, that is why I'm very passionate. I don't play with it. And it's good for all of us to come together to make sure that these funds are provided ab initio and make sure that it is released on time. It's not only the budgeting. Once it is budgeted, it must be released. And once it is released, it must be utilized. These are things that we don't play with.
All right.
Thank you, and over.
Thank you very much,
Thank you very much, Chika. Thank you for joining us this morning.
Yes, thank you very much. And of course, we'll go on a break. When we come back, is entertainment and sports. We'll be right back.
Our